This is tips, tricks, and secrets that very few nurses will share with you. This is just for you, whether you're a new nurse, a seasoned nurse, or you're thinking about becoming a nurse. Hi, I'm Shawnee, and welcome to the Nurse Executive Files. So, what I want to share with you today is the one thing that's going to help keep you anchored in nursing. I see a lot of nurses saying that this is a lot, this is hard, it's not what I expected, it's not enough money in it. I'm quitting bedside, I'm quitting nursing altogether. And I'm telling you today what is one thing that has kept me anchored to this nursing field for 25 years. And I got my little notebook here because I love to talk and I will get off topic. So I have my notebook here. And now I'm going to be brief. I don't want to hold you. I want you to get this nugget in this this nursing executive file, a tip here. So what is going to keep you anchored in nursing? So I've been in healthcare for about 25 years, and it's always seemed to be that there's this nursing shortage, it's not enough help. Sometimes people talk to you any kind of way, whether it is staff or whether it is the patients or the patient's family. And sometimes, when you blend your personal life in, you have a lot of stuff going on in your personal life, and then you come to work and you're like, I don't have to deal with this. I don't deal with this from people at home. I'm definitely not going to deal with it here. But so it's all different sorts of things. And we'll get into some of those dynamics in another video. And number one things that is going to keep you anchored in nursing is remembering your why. That is so very important. I encourage you to get a journal, any type of journal. And I want you to start making notes or just putting thoughts in there about why did you become a nurse? And I want you to really dig deep. And what I have noticed is that people that decide to go into nursing usually have experienced some type of trauma in their life, a crisis, or they may be, maybe a caregiver. They've taken care of a family member, or they've watched their parents or their family take care of someone else. And someone has probably said, hey, have you ever thought about going to nursing school? You would be amazing. But usually it's those emotions that life experience. My dad, military veteran, he had gotten hurt in a bicycle accident, and my mom was taking care of him. I remember my mom putting me on the bed with him, and he was at home, and I was very, very concerned. And he's like, you want to be a nurse? And I remember as far back as two saying yes. Some things I can't remember yesterday, but it's weird. I can remember some things early as 2 years old. And I remember that. And my mom has gone through a lot of changes, in life. She's the only child. And seeing her go through different things in life and just looking at even, friends that have gone through different things. But that has helped keep me to be anchored in nursing. And especially when you have a spiritual connection and you feel like that this is your calling. So if you feel like this is your gift, your calling, don't stop. And there's a huge world of nursing out there. And in nursing school, you're traditionally trained for acute care. And if you're thinking about a nurse or you're new to nursing terms, acute care, or just in general, acute care nursing is what's happening right now. There's someone that's sick right now. It's not so much focused on preventative health, keeping you healthy before you get sick. Acute care is hospital visit. Right now, you're learning about all the different organs and, what is happening to your heart, what is happening to the lungs. So they piece it together in nursing school. So it makes you think that all there is to nursing is the hospital life. And then you may know nursing home because usually by the time, you become a nurse, you've had some type of nursing experience, nursing assistant experience, like a CNA. And you'll get that experience first. And that'll be a good one. So we'll talk about that in another video as well, that nurse aid experience and how I feel like that makes you a better nurse. I will say that, but we'll talk about that later. Compared to a nurse that does not have the experience, so let's say a registered nurse versus, maybe a nurse practitioner that goes straight through the program. but I'm telling you, this is the nurse executive files is going to get heavy. So I got some good stuff in there to share with you. But again, I got off topic. But just remembering your why is going to be very important, especially acute care, because it is hard. A lot of times we've seen growing up that people want to make nursing sexy, make it look cute. I don't know where that came from. I don't know if it was a comic book that made it like that, but there's this thing that I think that leads people down the wrong way, that this is a sexy or a cute or a social media, speaking in today's term, social media type of thing, and that's just not what it is. It's far from it. People are sick out there. People are very sick, and our job is to, help save lives. So it gets pretty complex. But I remember my nurse aid days to sometimes I would have 10 to 12 residents and or patients for some people. If they live in a nursing home or long-term care facility, that's where they live. So they're called residents. They're not called patients at a nursing home. So that's a tip. Write that down. We'll get into, again, the executive files that's there for you. But I remember, I'm just like, I had 10 to 12 patients or residents, and I had to have them up very early, bathed, dressed, lined up in the dining hall or in the room set up, just like me and you would do now that like we're able. And I would literally be dripping with sweat. And a lot of times you wouldn't have anybody to help you out. They, for a split second, they may can help you transfer someone, but a lot of that is all on you. And it definitely helps to build resilience. It's a lot because they're depending on you for their care. Some of them, they can't walk. Some of them can walk. Some of them are independent. Some of them, just maybe need their tray set up for them. But for the most part, I'm like, man, there's just not enough help. And so I can see where it's, a shortage in nursing. But here's the thing. If you're not happy with where you are in nursing and you're like, I'm remembering my why and this is just not working, there's more to nursing. So there's post-acute care, there's acute care, there's intermediate care, there's what you call corporate nursing. That's a whole entire different space. We'll jump into that in another video. But there's more areas of nursing and specialty. You don't have to stay put. I would encourage at least maybe, let's say you get into a position, give it time. Some positions you're going to know right up front that I've been here for 6 months. I've did everything I could. I've talked to the nurse manager. I've tried to get support, and this is just not working for me. And you did all that you could to learn or to think about your environment, whether it's your commute, whether it is work-life balance. There's different areas in nursing. And I'm not saying jump from job to job to job to job. I'm not saying that. What I'm saying is that be intentional in building your nursing portfolio and what that looks like for you. I remember when I was coming into college, I used to always say, I want to be a neonatal nurse practitioner because it sounded cute. And then you go through clinical rotation, you're like, oh no, that's whew, I don't want to do that. But again, remembering your why is going to help you get through some of those most complex and challenging times in your nursing career. And as I had mentioned earlier, when you feel like that it's a spiritual alignment in your life, pray and, ask God to show you. Say, is this portion, is this area or specialty in nursing for me? Maybe there's another area in nursing that you will that you could excel in. And not saying that you can't excel in the portions that you don't like. It's just that you want to be happy where you are. And we know that when you're happy with where you are, you have better engagement, better performance, and people around you are also happy because they feel that energy. But being connected to your why is, I think, one of the most important foundations in nursing. But you let me know in the comments below what are some things that you feel has kept you anchored in nursing for all these years. And I say 25 years, but the first half was dedicated to nurse aid experience. And the later half of my 25 years, at this point, what is 2026? So I've been a registered nurse for about 15 years, I want to say. I want to say about 15 years. And then, of course, I fell in love with a different specialty of nursing, and give it a chance. It will make sense. There's so many different things that you can do in nursing to help relieve some of the stress. So sometimes it's not always about hiring more staff. Sometimes it's about looking at your current workflows, at what do we have now, and how can we ensure that our nurses are happy. Are they the right fit for the right patient or resident, or is this an area of their strength? And certain nurses will excel in certain areas. So yeah, it's a lot that goes into saying, hey, I feel like that we don't have enough help. I don't know what to do. I want to leave altogether. Don't let that be the main reason. I'm going to tell you right now, I feel like in any job that you have, depending on the season, whether it's you're hitting around the holidays, it's going to, feel like, or you're going to need additional help. But this nursing shortage that we're in, or nursing crisis shortage, or it seems like everybody is leaving the nursing profession. It was like that when I was coming into school, and the news loved to hype it up and compete to get better ratings and to impart fear. I want you to be careful in social media, taking on other people's experiences as your own lived experiences without even having to have experienced it yourself. Ooh, that was a mouthful. And sometimes by doing that, we can take on other people's traumas and fears, not even realizing that that particular area of nursing could be, a specialization that is calling you, that you may do very well in that area unexpectedly. And so just be careful when taking on, seeing things about, why people left the bedside. And that's their story. And it may be even a common story, but you are a one of a kind. You are unique at what you do. And we'll have to get into the butterfly effect also. That's another good one in nursing that someone has shared with me before at American Nurses Association conference, is your butterfly effect. Think about how many lives that you will impact based on your story, your testimony, your why, and how that will help develop your trajectory or your path in nursing to be able to help bless somebody else. So when you remember your why, think about why you came into nursing in the first place. Think about the excitement that you had when you first found out that you were accepted into that nursing school, or that the first time you found out, like, hey, this is what I want to do. I want to be a nurse, and I just got started in nursing school. I'm applying. I just got accepted. That love for nursing, that was for a reason, and that is a part of your why. Never lose sight of that. Or just think about how hard you had to study to get there, or what all you had to go through, your challenges, because in nursing school you will go through so much in your life, um, blood and sweat and tears, for a lot of people. And it's like, look where you've come from. You've come too far to look back. So you keep going. You keep going, and you find that specialty until it makes sense. And in my particular case, for example, nursing leadership, my path was a little bit different. It took me a little bit longer to get where I want to be, and I'm still getting to where I want to be. But I'm in a really good place, right now. But I'm always growing. You will always be becoming your best self and growing and evolving in nursing. And I think that it's like a marriage. That some people say when you first hear about being married, that the first couple of years can be the hardest years for some people. That's what I used to hear years ago when I got married. That you may go through a rough patch, but it gets easier. Just like having a brand new a baby for some. Those first few months, it's hard. You're trying to get the baby on schedule, and no one says, oh my God, I'm not having another baby. And I'm not trying to compare this to childbirth, but I'm just saying that every type of situation is going to have its own set of challenges getting in. So it's almost like its own initiation type of process, because very early on, They love to put new nurses in on night shift. Some people love to say, hey, well, you're great right here. We want you to stay right here. But there's so much more. You've worked hard to get to where you are, um, and so don't give that up. You became a nurse for a reason, and it was not for glamour or the money. It was something deeper, and you know that why. So I would love for you to tell me, in addition to, because that's not the only reason, remembering your why that will help keep you anchored in nursing, but I would love for you all to leave in the chat, drop a line here or there, of what you feel like will keep you anchored in nursing. And we know the challenges are going to be there. Like I said, I've been in healthcare for 25 years. The nursing shortage, there's a nursing crisis, has always been around. But what else can we do? What else is there that keeps you grounded to the one area that you've always loved? Because guess what? Somebody's got to do it, in this world, because we're born in this world and then we are out of this world. And someone has to do it. Someone has to do it. So why not you be the best person to make a difference in somebody's life? And I'm telling you, when people are at their most vulnerable time and they're sickest of the sickest and they are terrified whether they will, not wake up again, you will see a different side of people. People is like they will go through this transition from really mean, nasty, sometimes not always, to it's just like a curve, like a bell curve. And they wake up on the other end and almost wake up, let's just say, wake up call, for example, and they're different people. And that's the thing, it's really, really true that they may not remember your name, but they will always remember the way you made them feel. Like, that is so very true. And it feels so good to have that effect on people. I would love to hear what has kept you in nursing all these years to help motivate and encourage new nurses or nurses that are facing with burnout, those that have gone through that, to say, man, I went through all of that, but I'm still here in nursing, to help the next generation of nurses. And the next generation of nurses, that can be nurses that are, seasoned women that are in their 40s or their 50s. Education never stops. I know a good mentor, a friend of mine, I'd like to say, she's in her 90s and she still goes to school to this day, and she loves learning. So learning is a life learned process. So anyway, I'm going to stop here and hop over to the next video, and let's have a brief talk about PhDs or DNP or your doctorate versus common sense.